Good morning. 8 minutes to get through what I over-prepared for, so I might talk fast. As you heard, my name is Susan Chapman, and I'm at UCSF. I'm actually clinically trained as a nurse, and my whole clinical career in nursing was in mental health, and I have advanced practice in mental health nursing preparation as well. After that, I went back and got an MPH and a doctorate, wanting to look at mental health as an integrated part of a whole system of healthcare, and that was my goal, to sort of look at how we could better integrate. That was some 30 years ago, so we're still trying to get there, right? So I'm going to talk just briefly about this. Most of this, what I'm talking about today, is from some research that I've done in our workforce area. And one of these was a study of peer providers that we did with SAMHSA support a couple of years ago. In this case, here's the definition from SAMHSA of what a peer provider is. The key things here are that lived experience and some training to help deliver support to a recovery-oriented setting. And we've heard already today about peer support workers working with children, youth, and families. I think there's a need. This is a growing workforce, and there's a need here to invest further in those resources. Our study was mostly on adults. We did a landscape analysis. At the bottom there is a reference to our website where you can see these reports. We did a national landscape analysis on training, certification, et cetera. And then we visited 4 states where we thought we had best practices of peer provider support services. We found peers working, again, with adults in a variety of settings, including organizations that were run by peers, as well as traditional settings, and more in forensic settings, including drug courts and releases from incarceration. Medicaid payment has certainly enhanced this as an employment opportunity, as an opportunity to be billed for these services. That was from the late 2000s. Training and certification is a very mixed bag across the country, with some states having it more formal than others. 40 states have statewide certification, and about a third have statewide certification for substance use disorders. In that population, we certainly found some of the stigma in acceptance and challenges in working as a peer support provider alongside the professional workforce. Some organizations absolutely embrace this, and some are still hesitant. The evidence of efficacy in the research side is still somewhat mixed. Turning to nursing, how many nurses in the room? Great. Okay, not enough of us, right? For a 3 million number workforce. We have a variety of nurses involved, or not, depending on their training and their practice. First, looking at pediatric nurse practitioners and their role in behavioral health. I think you'll probably hear more about that later. That is not my expertise. Certainly family nurse practitioners. I'm going to talk a little bit more about the advanced practice psychiatric mental health nurse practitioners. That's where I've done most of my research. In 2016, there was a survey of these providers, and one of the pieces of data, this was done by Delaney and her colleagues at Rush University, that only about 14% reported that most of their services were provided to those age 1 to 20, but more importantly, 19% provided no services to those in that age group. That we do have a national sample survey of RNs. These are not the advanced practice nurses, but just straight RNs, and from what I could see from the data, again, not a whole lot of specificity, but only 4% report working in mental health or substance abuse, and 6% in pediatric specialties. So how many, can psych nurse practitioners fill this gap? We've seen the shortage, particularly in psychiatry, and even more pronounced in child psychiatry. The supply, well, we don't have very good data here, right? Estimated between 9,000 and 19,000. That's all depending on the source and who's counting and where you get the data. As nursing does, we've made this very complicated from a certification perspective. It began as a clinical nurse specialist certification. I'm not going to go into those details. I can answer that later if necessary. But now it's primarily the nurse practitioner. Scope of practice varies by state. I'm going to go back to that in a minute. And the numbers, again, from the credentialing center are about 5,000 CNSs and about 8,000 NPs. This is a growing profession with about 118 programs. So why should we look possibly at psych nurse practitioners to fill this gap? One is that they provide many of the same services that psychiatrists provide, including the ability to prescribe medications. They are educated in an integrative practice model, so that nursing piece with the holistic training comes in importantly. From research, patient satisfaction has been high, and it's a shorter time training than for psychiatry. Why do they not already fill the gap? Part of that is scope of practice limitations, which vary by state. In most states, nurses can prescribe medication, but there's a supervision requirement that makes this difficult in many states where the oversight is just makes it hard to do private practice or is a burden viewed by the settings. There's a challenge in even recruiting in this area. Lack of awareness in sites on what who they are and what they can do, as well as non-competitive salaries, and acceptance by other providers on the team. Our research, where we went to places that were friendly to psych NPs because they were using them, we found none of those challenges. But still, we went to the sites that were using them, and so we don't know who's not using them and why. I'm going to switch a little bit here in just about a minute. We have a poster in this later. This is one of my graduate students' dissertation work. Let's think about where else we provide important behavioral health services. And one is the school, right? It's an opportunity or a place where we can provide services. This is from my colleague's dissertation work, and we have a poster on this later, so please stop by. Of the schools that have school-based health centers, 70% of them have mental health included. That's the good news. The challenge is only 2% of schools have school-based health centers. How are they staffed? Well, they are certainly staffed by nurse practitioners who do, this is the primary care staffing. We did compare schools that have mental health providers and not, and this is not too different here in terms of the primary care staffing. Nurse practitioners, and this is family, pediatric, primarily nurse practitioners, do a lot of the work. Also, some physicians and physician's assistants, and I don't know why the nurse midwives also do women's health care. That's primarily what that's about. These are other staffing figures for the school-based health centers with social workers, therapists, unlicensed social workers, psychologists, et cetera, a variety of staffing. Although, as you see on the end there, only 3% of them had psych nurse practitioners. There's definitely a need for school-based health centers to have mental health services. This is a survey that's done in California in the high schools, Healthy California Kids survey. I think that these data probably can apply across states. This is about 600,000 students. And these are the incidents of victimizing events. I have pages of this. These are only a few examples from the 6th grade to the 12th of, sexual gestures and jokes and rumors and been made fun of and pushed and slapped, and it even goes down to, dangerous behaviors, carrying a gun to school, being in fights, etc. So clearly a need here. In terms of substance use, these are, again, by grade level. Past 30 days, 5 drinks in a row, 25% of 11th and 12th graders. So clearly the need is here. When I asked my colleagues, what would you do? What do we need to do here? One thing is to think about utilizing every type of worker to the full capacity of their education and experience. More focused training on children, youth, and family. In our nurse practitioner program, which is one of the largest in the state, we have difficulty finding clinical training opportunities for our students who want to work with children. It's just hard to find the practice sites. And then focusing on the team model, who needs to be on the team, including the family, how do we integrate, and let's be sure that we include the family, the school, and the community. Thank you so much.